Amy Marsalis. Brought to you by St. Thomas Health Services.
Hi everyone, and welcome to Medical Monday. I'm Amy Marsalis. Glad you're with us tonight. Should be a fantastic program. We're going to be talking about cataract surgery and some great cutting-edge new technology. We have a patient here tonight you'll meet in our next segment who underwent this procedure. Right now she's just going to take in the program for a few minutes and watch her physician. Cataract surgery, by the way, is one of the most common operations performed in the United States. It's one of the safest, one of the most effective. 90% of the cases of people who have had this kind of surgery, the patients have better vision afterwards. Who is at risk? Are you at risk? What kind of procedures are out there? Let's get right to it with Dr. Jeffrey Horn, an ophthalmologist at Vision for Life at Baptist and St. Thomas Hospitals. Good to have you in tonight, Dr. Horn.
Thank you very much. Pleasure to be here.
Okay, now let's start with who is at risk. You always think of people who are older, and I mean much older.
Right.
Who is at risk?
Well, the general rule of thumb is that everyone ultimately, as they get older, is going to get a cataract. What I like to joke about with patients when they ask me, why did I get this cataract, Dr. Horn? And I always say, well, birthdays.
That's it.
And there's no way around it. There are other people who may get it because of medications they take. Some steroids can do that. Even people who take inhaled steroids for asthma have been known to get cataracts. Steroids in joints for steroid injections. I've seen patients get cataracts after that. Diabetic patients, even if they don't have any severe eye disease from their diabetes, they tend to get cataracts about 10 to 15 years earlier than their non-diabetic counterparts. Some people are born with them. Some types of trauma can cause it, or other diseases or medications to treat these diseases can cause it. But the most common reason why one gets cataracts is because everyone will get them if they live long enough.
I was going to say, is there anything you can do to prevent it through good diet, avoiding smoking? Is there anything else you can do?
Well, I certainly think all of those are good things to do, not only because they benefit the eyes, but because they benefit the rest of the body. And the eye is not disconnected from the eye. So anything you can do to help your overall health, certainly I think will help your eyes. But unfortunately, there has not been any study that has shown that is credible, in my opinion, that shows that these vitamins or anything else can actually reduce the incidence of cataracts.
What talk has there been out there floating around about vitamins and helping the eye?
Well, there was a study, which is a very, very good study, sponsored by the National Institute of Health, the National Eye Institute, called the AREDS, A-R-E-D-S, the Age-Related Eye Disease Study. And it looked at patients to see whether they developed cataracts with nutritional supplement over a period of time. It also looked to see whether macular degeneration progressed over a period of time and whether supplements had any effect in terms of reducing the progression. And what it showed was that cataracts were going to progress regardless. Vitamins didn't help, but the vitamins did help patients with macular degeneration if they had moderate to severe macular degeneration already. There was definitely a reduction in bad outcomes and vision loss, but cataracts, there was no effect. People were going to get them, they're going to get them.
Now I know we have some tape and some animation. Why don't you walk us through the first piece of tape? I believe that's how the eye works.
Right.
Is that right?
Yes.
If you can see a monitor, go ahead, doctor.
So essentially the eye is like a camera, and your camera takes a picture, your eye takes a picture as well, and you can see there's the animation of the camera looking at a flower. If you were to take a picture of your flower, your camera wouldn't do the seeing, but you would process it, and the eye is very much the same way. Here, the eye is acting like a camera. The light rays from the flower travel through the lens, hit the eye, and focus on the retina behind it. And it's and a cataract, for example, is when that lens becomes cloudy. It just gets cloudy. Chemical changes in the lens cause the lens to change, and no longer is the image clear, and people get scattering of light and glare and things like that.
So how does that cataract form? I read something about clumps of protein. Those are the little pieces coming together. What is the process? Can you explain that in layman's terms?
Well, it's very, very complicated, but the human lens, what we call the human crystalline lens, that is made out of different types of proteins, among other things. And what happens over a period of time is these proteins change and the chemical composition of the lens changes, and in so doing the lens becomes less transparent, less light gets through.
Okay.
And therefore, less light actually gets to the retina, which is like the film in the eye, film in the camera, and less light gets through. And light that hits that lens also scatters, and it creates a lot of glare. So people with cataracts often will find that they have problems with nighttime driving. They don't see as well. They're not getting enough light in, and the light that does come in creates a lot of glare and halos, and headlights coming at them make it very difficult to see.
What are some of the other symptoms of cataracts?
That's probably the most common one that I see,
yeah. Okay.
Patients just not seeing as well. It depends upon the patient's daily activities. If a patient is spending a lot of time driving, that's probably the most common thing that they'll see. But patients may have trouble seeing for reading. Their colors may become distorted. They just don't see as clearly. But often, because the cataract grows so slowly over such a long period of time, patient gradually adapts and adjusts to the decreased vision, and they often don't know that their vision is impaired. And until they take their first cataract out, and then they find, wow, it's a whole new world.
Yeah. Oh, I'll bet.
That is classic. That just happens literally every day.
Well, how often should you have your eyes checked? And, you know, I don't know if people go on a regular basis unless they wear glasses or they have a sudden kind of change, which in most cases it isn't sudden unless you're in an accident or something.
Right. I would say that for anybody over the age of 50, that it's probably a good idea for them to get their eyes checked once a year. Patients that are more nearsighted, that may have other risks of retinal detachment, they should probably get their eyes dilated once every 1 or 2 years. If they have a family history of glaucoma or macular degeneration, they should have their eyes checked more regularly. But I'd say after the age of 50, probably once a year. Prior to that, maybe once every 1 to 3 years.
Is it true, at least it used to be, that you would wait till the very, very last possible moment to have anything done to a cataract? Is that the philosophy still, or no?
That is the term ripe comes to mind.
Ripe. I read that. Ripe. Okay.
And that's just an outdated, antiquated term. The reason why ripe or dense cataracts people would wait so long was because the quality of the vision afterward wasn't much better than the cataract itself. So since the solution wasn't much better than the problem, you'd have to wait for the problem to really become advanced before you would ever decide to operate. You always want to make sure that the benefit of doing the surgery and the risk of doing the surgery is less than the risk of leaving it alone. And now, with current technology, not only in terms of how well we can take cataracts out. I mean, it's an outpatient procedure. In my hands, it's a 5 or 6, 7-minute procedure. Patients home, within 20 minutes of having their surgery or on their way home. New technology implants that allow people to see much better, even better than they have seen in the past. Prior to their cataract, in some instances, new technology to remove the lenses, small incisions, and things like that really allow us to correct the problem much earlier. But other things like really knowing that and understanding how the lens and cataract are affecting people's vision long before the cataract may become dense. And we now have an understanding of how cataracts affect people's functional vision. You can walk into your eye doctor's office, they'll turn the lights down, black letters on a white screen, and show you the letters, and you might see very well. But then walk outside and drive a car at night and say, my doctor said I could see, but I'm really having trouble. It's because the lens is changing even before the cataract becomes dense. And so we're finding that we're taking cataracts out in younger and younger patients because their improvement and the solution to the problem is much better than the problem much earlier. So really, you take a cataract out when it's bothering you. It's different for different people. When it's affecting the quality of your vision and the quality of your life. Cataracts have been shown to increase the risk of car accidents by at least 2 to 6 times as much as if they didn't have cataracts. Taking them out reduces the risk of car accidents. So for people that are doing these tasks, they may benefit from cataract surgery long before their parents did, for example. And because they may not recognize their vision got worse or that it's worsening. That's the reason for having routine annual eye exams when you get into that cataract age range.
Now, if you do get an implant, if you go through a procedure and you get some kind of implant, could you possibly have another cataract grow back? I mean, I just thought let's say you've got an implant, you have a new lens, but the process that created that previous cataract, is that still going on in your body? Right,
and that's a great question. When we take the cataract out, we're taking out the human lens. And we're doing so in using very small incisions, new technology to break the lens up inside the eye, Traditionally, the small incision has been ultrasound surgery. Now we have new technology which we can talk about and get into, using hot water pulses to break the cataract up, and that can emulsify the lens, sort of like washing the cataract away. It's a more gentle way of doing it. And then inside that same part of the eye that the human lens was just removed from, through that same very small incision, we can implant the implant. It's soft and foldable. It goes inside the small incision, and then inside the eye unfolds gently. And it sits in that same part of the eye. So you can't technically get a cataract back, because your human lens was the cataract, and that's been removed. But sometimes, in about 10% of patients, depending upon their age and the type of cataract they had, the type of lens implant that was used may also play a role. Sometimes that capsule can get a little bit cloudy, and patients may start noticing symptoms very similar to their original surgery, their original symptoms from the cataract, and at that point, a simple, quick laser procedure can open that cloudy capsule up and solve the problem.
Okay. All right. I think we're probably coming up close to break time, aren't we? Let me check with the director. Okay, we are. When we come back, you're going to hear from one of Dr. Horn's patients, Betty Henderson, standing by. She'll join us. We also have more animation and a lot more to talk about, exciting new procedures for cataracts. So stay tuned. We'll be right back. If you're just tuning in, my guest tonight, Dr. Jeffrey Horn, an ophthalmologist at Vision for Life at Baptist and St. Thomas Hospitals, and Betty Henderson, one of his patients, who was kind enough to come in tonight and share her story with us. And Betty, obviously you had cataract surgery, but tell us how you got to Dr. Horn and what was troubling you. How did you kind of, sort of, no pun intended, you sort of stumbled into this whole procedure, didn't you?
I did. I stumbled in.
How did it
stumbled
happen?
into his office for a new pair of glasses. He was at Vanderbilt. I went to Vanderbilt. My husband took me there, and that was the first time I saw him. And I came out with a new pair of eyes.
Because you really went in for new glasses?
I went in. I could not see faces. For a year, my eyes were just getting worse and worse. I couldn't see faces. And so I talked with Dr. Horn. He examined my eyes. He did give me a new pair of glasses and told me to come back, I believe, in 6 months. Well, it was longer than that because I was traveling. So when I came back to talk with him, he examined my eyes again. In fact, Dr. Horn is not going to brag on himself. So let me just say.
Well, you go ahead and do it then.
I want to tell you my personal opinion.
Okay.
We are so fortunate here in Nashville, right here in Nashville, to have him, because he is known worldwide. He travels, he lectures, he teaches other doctors how to do this new procedure.
Which is what you had?
And this is what I had.
Okay.
I had the new implant.
And Dr. Horn, why don't you jump in now and talk about, and I know we have animation, I don't know if it's of that procedure, but what did you do for Betty? What kind of procedure is she talking about?
Well, we have animation of at least a general procedure. What I did was, she had a cataract, so I examined her, and she had clouding of her lens, and that's why she wasn't seeing quite as well. And we watched it. You don't have to necessarily jump right in. You can be conservative. And we took the cataract out ultimately when she decided that it was really affecting her activities of daily living. And we felt that it was the right time to do that. And what we did was we used a new technology both to remove the cataract and also new technology to actually improve her vision. So the first thing we did was use the technology called Aqualace.
Is that what we're looking at, or no?
We make a very small incision, and that's an Aqualace handpiece that can go through and basically use hot water pulses to evacuate and vacuum out the lens, and then in that same small incision, you can see the little capsule that the human lens was removed from. That's the implant going in, and it gently unfolds, and that's it, and the procedure's done. It usually doesn't require a stitch, and as I said, it's 5, 6, 7 minutes. It's done under just an eye drop to numb the eye up, little relaxing medication, and then patients can go out. We do one eye at a time. We see them the next day. If everything looks good, we can do the other eye within the next 2 to 3 weeks.
Now, what's fascinating about this is that you get both distance and close-up vision.
Well, in most cataract surgeries that have been performed around the world, the implants that we would use correct only one distance. They're monofocal. We would put them in for distance, and they would see far away, and they'd put on reading glasses. And that is what has become one of the most popular procedures in the entire world, is to be able to see for distance and then put on reading glasses. Some people would have monovision, where we correct one eye for distance and the other eye for reading, but then they wouldn't be able to use both eyes together. And that wouldn't do away with the glasses, but it would reduce the dependence. Now, we have new technology, and the lens that Mrs. Henderson got is called the Restore lens. It's made by a company called Alcon Labs.
Yes, I've heard of Restore lens, okay.
And there are other lenses that are similar to it, but she got the Restore lens. The Restore lens gives excellent distance vision and unparalleled reading vision through the same lens in both eyes. So she has one lens for distance in one eye and one lens for distance in the other. No more separating the two eyes.
Wow.
So she can see far with both eyes, and she can read with both eyes. And when I first started using this implant, after I left Vanderbilt in August, I used it, and I was very impressed with the clinical trial data. 80% of patients who got this lens in the clinical trial for the FDA said they no longer wore glasses for any purposes ever. 94% said they would do it again. So it really seemed like it was very, very good technology. And when I put the lens in, I started to see it was not just good technology. I was amazed. I still am.
Really?
And that's the God's honest truth. I cannot believe how well my patients can see far and close. I've done over 4,000 cataract surgeries, and I have never, ever seen anything like this, where people can see far, they can read, they can see in between, and it seems to really make a difference in people's lives.
So no glasses at all anymore?
Amy, I have not worn glasses since I had my second eye surgery, November 1. And the day after I had that surgery, I was driving down to his office, and I felt like a 6-year-old. I was reading every sign along every billboard that I couldn't even see before, and it's just perfect. My eyesight this evening, before I came down here, I threaded a needle and sewed 2 buttons on my husband's shirt with naked eye.
My goodness, so you probably see better now than you had for years prior to even the cataracts developing.
Yes. It's amazing. It's like I have new eyes.
How did you feel right after the surgery? Was there a little blurriness for a little while, or immediate kind of great vision?
There is nothing. I think the first surgery they had put a little salve in my eye, but as soon as that cleared up, but you wear a shield over that eye and to sleep in it. But no, I could see the next morning.
So no negative to it at all? I mean, it's just...
No negative. I would do it again tomorrow.